Southern 7 Health Department and Head Start, making a difference in your community, one family at a time.
Welcome back, listener, to the Southern 7 podcast. Joining me today are some really great folks that we have partnered with for a very long time here at Southern 7, and I wanted to make sure that each of you had an opportunity to introduce yourself. But folks, we are excited about today's podcast, and I'm really going to encourage you to share this one with others in your loop. Make sure you get this out to folks. Joining me today are Madeline Bernard, Hassan Gone Wrong, and Mary Grace Sharp, correct? Okay. Yep. All right, ladies, want to make sure I get the names right. And we're going to be talking with you, listener, today about two programs that we have here at Southern 7 Health Department, which are our cancer prevention programs. And we'll introduce those to you here in just a bit. But before we get rolling into all of that, I'm just going to kind of go around our video here and again, we say video because if you're listening to this on an audio podcast, you can view this on our YouTube channel. So make sure that you do that as well. So I'm just going to go ahead and start by introducing Madeline Bernard. Maddie, tell us about yourself.
Hello.
Who you are, all the goodies. Hi, how's it going?
Good morning. Yes, we're fresh back from our Thanksgiving break here up in Chicago. So I'm Maddie. I am one of the program managers with the Center for Advancing Health Equity. We've been working alongside Penn State with Southern 7 Health Departments for quite a time. And yeah, we're up in Chicago. I know we were chatting right before this, getting the cold weather moving in. So just settling in from our break, but happy to be here.
Great. Good to see you, Maddie. Thank you. Pasang, you next.
Thanks, Shauna. Hi, everyone. I'm Pasang. I am also a program manager for the cancer prevention team, working alongside Maddie and Mary Grace.
Great. Thanks, Pasang. Maddie, Mary Grace, you're last. We'll let you go next.
Hi, everyone. My name is Mary Grace. I'm a senior program manager on the chronic and infectious disease team. So I do a lot with hepatitis and vaccination programs.
Okay. And ladies, the reason that we're here today is to share with our listeners about our HBV, which is our hepatitis B program, as well as our FIT program, which stands for Fecal Immunochemical Test. And we've been doing these programs for several years. I think our FIT program, we're going on our 5th year, if I've calculated right, and our HBV, our 4th year. But let's give a little bit of background into the programs and why we're doing them here at Southern 7. Who would like to introduce that? Maddie, would you like to talk about FIT?
Absolutely. Absolutely. Like you said, that we have had this partnership for quite some time. The southern region of Illinois has been identified as a hotspot, we say. But we just see it as so many people to reach, so much opportunity to reach community through programs like FIT and through specifically our CARES program. So yes, we've been working with Southern 7 since 2017. You guys were one of our original partners, really one of the pride and joys of the program, honestly. And we, with our CARES program, we're able to partner with different departments for funding and programming around FIT, making sure patients are reminded of when they're eligible for colorectal cancer screening, where they're able to find these resources, and how easy it is to get screened. I mean, these FIT tests are easy at-home tests. They're very easy to return. You've got warm faces like Shauna's to return them to. And talk to with all of your questions and their team at Southern 7. So we saw the opportunity to bring this program to Southern 7, and it's been a great hit. I mean, we've been doing it for so many years now. And we've also rolled out the Flu Fit program, which I know Pasang is involved in. So I don't know if you want to talk about Flu Fit a little bit as well.
Sure. Thanks, Maddie. I think the Flu Fit program is the one that was started in 2018. Is that correct, Shauna, or 2017? And it's basically working alongside we have our fit kits and then also flu shots. So during flu clinic, flu season, folks can get their flu shot and also learn more about colorectal cancer screening. Like Maddie mentioned, Southern Illinois is one of the 3 hotspots in the nation for CRC mortality. So we really want to make sure that folks are learning about what colorectal cancer is and how to get screened, and especially these fit kits, which are non-invasive, super simple, super easy. They can be done at home and just mailed back to the health department. So that's a little bit about our flu fit kit program.
Okay, great. And yeah, we're going to share with our listeners more about the FIT program, how they can acquire a kit, why it's important for them to get a kit and get that screening process started. But before we do that, let's go ahead and turn things over to Mary Grace. Mary Grace, you're not really, I mean, you're kind of new with us on this program. You've been working on it now for a little over a year, I believe, with us. Tell our listener about the HBV program and what that means to them.
Yeah, so for hepatitis B, we really are just trying to get out the word and the outreach and tell people that, hepatitis B is kind of a silent epidemic, because people don't know that they have it, since there's not many symptoms that are correlated or with it. And so when people are newly affected or chronically infected, it might not show until, unfortunately, you start developing really serious liver infections. So what we try to do with our program for hepatitis B is just spread awareness of what hepatitis B is, how hepatitis B is spread, which is actually most commonly perinatal, so from mother to baby, but other people know it is, spread through direct contact with infected blood or certain bodily fluids. So really just telling people that hepatitis B is completely preventable and treatable. And the only really way to understand your status is by getting a test. So it's a 3-panel blood test. It's really easy. And a lot of people don't understand or know that, like, in order to get tested for hepatitis B, it's quite simple. If you have an annual doctor's appointment, you can just ask them to add a hepatitis B screening, and it's free of cost. And so just trying to spread the word about, getting tested for hepatitis B and what it is and what it can become, which is, serious liver infection and liver cancer.
Okay, so, for someone who may be thinking, okay, why are you talking colorectal cancer and HBV in one podcast? The reason is that these are cancer preventatives. When you get screened for colorectal cancer, whether it's through FIT or you get a colonoscopy, that's preventing colorectal cancer. When you are vaccinated against the hepatitis B virus, again, hepatitis B can go on, and if not treated, could turn into liver cancer. So that's the focus of our conversation today. And these are the 2 programs that we work through with Penn State, with the Asian Health Coalition, getting that information out to folks. So let's come back to FIT for just a minute. First off, Pasang, who's eligible for the FIT program? Tell us about those demographics.
Yeah, so for the fit kits, we primarily are asking people from 45 to 75 years of age. And with fit kits also who don't have a family history of cancers, colorectal cancer. So if they do have a history, we really require them to get a colonoscopy, which is considered the gold standard. But for those who don't have family history, a fit kit is honestly the best and easy, simple way of getting screened.
Okay, and we also, in addition to the age range of 45 to 75, here at the health department, we also screen anyone who has an increased risk. If you've got colorectal cancer in your family, if you yourself have had a colonoscopy and you've had polyps, that puts you at a higher risk. So sometimes we look outside of that age box just a little bit. So we want people to know if they do have any questions at all about their eligibility for the FIT program, give us a call and we can share that with you. And we'll have all that information for you at the end of our podcast. Now, we're bouncing back and forth. Mary Grace, and when it comes to who should be tested for HBV, and first off, I want people to realize we don't test for HBV here at the health department. We do vaccinate, but who should test for that?
Yeah. So the CDC just changed the recommendation from a risk-based screening recommendation to a universal. So it's really just any adult 18 or older should be tested for hepatitis B at least once in their lifetime.
Okay, and babies born after what, like 90 92, 93, somewhere in the mid 90s. Generally
Yes.
started on that prior to that, but we're really talking to those individuals prior to the 90s
Mhm.
might not have had
Who
the
didn't have the vaccination. Yeah. Yeah. So like you're saying with vaccination, the birth dose is now there's a 2 or 3 dosage that children should all get for hepatitis B, and kind of similar to what we were saying. CDC changed the recommendation recently, but all adults 19 to 59 should be vaccinated against hepatitis B if they have not been. And just to know if you have or haven't been, it's a really easy just blood test, the screening that we were talking about that can indicate if you've been vaccinated or not. So if you're not sure, then get screened first, and then you can easily get vaccinated after that.
right, because
Oh, so
hepatitis B. I'm sorry, Maddie, go ahead.
the blood test, I didn't even know this. The blood test, you can learn if you've been vaccinated as well.
Yeah. Yeah, so the blood test gives you a few different results. It will tell you if you're immune, which means you've been vaccinated. If you're susceptible, meaning you have not been vaccinated, you're not positive for Hep B, but you could be. And then it tells you like you have a resolved infection, if you're currently positive infected, and there's a couple of other results that you can get as well.
Okay. See,
So
we're all
that's
learning.
important. Yeah, I mean, so that's important if you yourself don't know, but you're wanting to, if you're a woman who's wanting to have a baby, or if you're a
Yep.
couple that's wanting to have a baby, it's important to get that information so you're not passing that on to your infant, to your unborn child.
Yeah. They say at every pregnancy you should get tested for hepatitis B if you haven't been yet,
Okay.
because perinatal is the most common way to pass it.
Mm-hmm. And now hepatitis B is also a bloodborne illness, correct?
Correct. Yeah. So it can be spread through blood or bodily fluids. That's another way. So I know other people's at risk can include a person who used drugs, injection drugs. They're commonly at risk for spreading it as well. So that's why, you know, there's a lot of different populations of people that are more at risk for hepatitis B. And, you know, that's why they always say to just have safe sex practices, things like that, so you don't spread it.
Okay, very good. Now, you know, for us down here in our region, we see a high incident rates of cancer, and that's one of the reasons why we do the programs that we're talking about today. We're seeing that. But, you know, when you're looking at the nation as a whole and determining, you know, what do we see nationwide in comparison to what we see in our region? Are we kind of seeing about the same number percentage wise of cases? I mean, like for us, you know, Maddie was talking about hotspots. You know, we sit in one of 3 hotspots in the country for high incident rates. What do we see in comparison with the rest of the country when we look at our region? Do we know those numbers? Maddie?
Colorectal, yeah, for colorectal cancer, I think the hot spot so much is referring to diagnoses and mortality. So that's taking who is diagnosed and, you know, who's able to be treated or left untreated, and that leads to a fatality. So that's where the disease needs to be taken very seriously. Whereas in the rest of the country, and honestly in Illinois as well, Southern Illinois, we're seeing we're seeing an increase in early stage diagnoses and also younger. So that 45 age range that Basang was talking about was actually a more recent move. So even those who have just turned, you know, 47, they're like, wait a second, I've been growing up and they've been telling me I don't need to be screened until 50. And then this change just came a few years ago. So the recommendations are changing with the kind of national trends. We're seeing very similar things. It is something to look out for as well, that they are getting diagnosed in younger patients, which is great. Like Shauna had mentioned, if you are outside that 45 age range and you have concern of any sort, no one is going to stop, no one's going to discourage you from getting a test. Of course, we always say the best kind of test is the one that gets done. So if there's a concern, or if there's, you know, just to put your mind at ease or any of that, then absolutely encourage that easy fit test. But yeah, trends, the early stage is it's easy to treat. It's the colonoscopy can remove polyps, can remove lesions, and we can we have the resources at Southern Seven's program to kind of guide you into that further treatment if necessary. But I think to my knowledge, Passan, correct me if I'm wrong, the trends are pretty similar in that there is a decrease overall, but where we're seeing more of a spread through younger ages and earlier stages as well.
Okay.
And then just to add, I think Illinois has also one of the lowest quartiles of screening compared to other states. So we really want to make sure that everyone in Illinois is getting screened, and we know that there is disproportionate burdens for communities of color and rural communities. So it's been really great. That's why we also partner with Southern Illinois and also all over Illinois. So making sure that Illinoisans are getting screened.
So when it comes to colorectal cancer, what you're saying is we're seeing fewer people getting colonoscopies, participating in FIT in Illinois than when compared to the rest of the country?
Yeah, our CRC screening numbers are lower than other states.
I did not know that. Okay. And I'm sure a lot of things factor into that. I mean, patients not having insurance or, just their general way of dealing with things. So, wow, that's new. That's new information. Mary Grace, what about HBV? Are we seeing, what do we see there compared with the rest of the country?
Yeah, so I think for hepatitis B, we do a lot with the immigrant population. So individuals who are foreign born, they are the ones who have shown most risk when it comes to having hepatitis B. So for example, I know that foreign-born Asians are it's 1 in 12 foreign-born Asians have hepatitis B, and 1 in 10 African-born immigrants have hepatitis B. So we try to really target those populations, the immigrant populations, since they're the ones who have hepatitis B, have not been tested or vaccinated, and then unfortunately they'll pass it along.
Okay. Oh, wow. Okay. Learning all kinds of new things today. That's amazing. Okay, now let's go back to what Maddie was saying about, reasons to test early when it comes to colorectal cancer. And then we'll also talk about that with HBV as well. But when you're looking at colorectal cancer, one of the reasons that we have this program in our region is we have wonderful hospitals here in the lower 7 counties in Illinois. And by the way, listener, Southern 7 is in the lower 7 counties in Illinois. With our hospitals we have here, they do very good with offering colonoscopies and encouraging patients. Our rural health clinics do as well. Our partner, which is Community Health and Emergency Services, which is Chessie in this effort, do a very good job of getting that early stage stuff done. But when we've got a patient that needs that extended care, they've had a positive kit, they've gone on for colonoscopy, turns out, yes, they have colon cancer, then that's when we rely on our medical teams outside of our region, because our local folks don't have cancer treatment center right here in our Southern 7 region. So early test is so important. Like you said, Maddie, Mary Grace Passan, that getting that early test done can prevent you extended travel outside of the region, extended cost outside the region, and so on. But again, longer life. And that's what this is all about. So for our folks down here who are up against it when it comes to economic disadvantages, health disadvantages, these two tools, testing for HBV and testing for colorectal cancer and those early ages prevents problems down the line. So that's why we do this. We all know that treatment for colorectal cancer is getting polyps removed and maybe going on for more advanced care, which we do help support patients through Union County Hospital program and some of our other hospitals with getting, free colonoscopies if they qualify. But Mary Grace, for HBV, what kind of treatment are we looking there? Somebody says, okay, I've gotten tested, I'm positive. What can they expect?
Yeah, so hepatitis B is a little difficult. There's treatments for it, but there's no cure at the moment. So really that's why testing early is so important, because not only, like you were saying, does it reduce mortality, morbidity, but it also can be cost effective because then you don't have to go through treatments. You don't have to go through all of the pain of having the disease. But hepatitis B can turn into hepatitis D. So if you are Hep B positive, you can become Hep D positive, and that's a really deadly disease. It's called the piggyback, virus because it piggybacks off of the, active Hep B virus. And so that's why it's important really to treat Hep B early, is because it can turn into other diseases if not left or if left untreated. So hepatitis D is one of a really good example of that.
So where does hepatitis A come into all of this? I mean, is that
Hepatitis A is the one you get with food when you ingest it. So that virus is the most, I would say, probably one of the most common, but it's the easiest to treat because it's foodborne. I think that's the one that, you can get with, like, you see a lot of like hepatitis A outbreaks, like strawberries or things like that. And so that's that one. It's more of a foodborne. I wouldn't say foodborne, but it's not bloodborne. It's different.
So hepatitis B and hepatitis C, they're bloodborne.
Yes. And D is you only can get that if you're Hep B positive. So.
Oh, okay.
Mhm.
All right. And none of these are airborne, correct?
I don't believe so.
No. Okay. So, okay. All right. Because we get people that ask, what's the difference? I honestly don't know. So yeah, I mean, to address that's very important for folks that might be concerned about that. Anything else on that we need to address?
Nope. No, I just did a quick search just in case to make sure I'm giving you the right information.
Yeah.
But yeah, hepatitis A is spread via contact with food and water and other people who've been infected. It's not airborne, and Hep B and B are not airborne either.
Okay. So you're not going to get any of the hepatitis series from just being in the room with somebody or anything like that. So we often think virus and we think, okay.
Yeah.
Airborne of that nature. But again, we want folks to realize that's not what you're seeing with this. Okay, so let's hop back to FIT for just a little bit here. And Maddie or Pasang, either one of you, tell us how the FIT the testing program works. If somebody wants to do this, explain to them how this works. What do they need to do? Do they need to talk to their doctor about it? How does this work for them?
I can start off, Maddie, if you want to add on later. So it's the FIT test is very simple and very easy. You don't need to go to your doctor. Actually, if you go on Southern 7 Health Department website, you can fill out your ad form and then they'll mail you a FIT kit. And it's a stool-based test. It's non-invasive. You will get a mailed kit from Southern 7 if you use their website. And it's basically just a stool-based test where you can do your business. The instructions are very simple, and then kind of mail it back. And then in a week or two, Southern 7 will send you your results back. And if it's negative, you're good to go, and you'll just have to do it annually. Or if it is positive, someone from Southern 7 will call you and will work with you to get a referral for a colonoscopy. But it's a very simple stool-based test that detects blood.
Maddie, do you have
anything else to add?
Yeah, no, that was spot on. It's just how easy it is to mail it back and get those results. And if it's positive or we say abnormal, it's not, oh gosh, panic. How am I going to pay for this? What am I going to do? We have the resources for you. That's why you get the call from Southern 7 or whoever you've gotten the kit from. There will be follow-up. There will be a referral to care. If you don't have a primary care, then we are able to work with you and connect you to follow-up care to get that colonoscopy. Again, Shauna had mentioned there are resources to make sure that's not a cost burden on you either. So we don't want people to shy away. I think, there's, like we said, there's lots of hurdles to screening, but really don't want fear of, oh gosh, what comes next to be one of them. Because you have the support from departments, you have the support from programs like the ones that we run that are there to ensure that you don't fall through the cracks, that if there is something that you will be taken care of to the very end, to the all clear stamp.
Exactly. And we want people to realize that the test is free. We don't even charge it to their insurance. This is part of the grant that we have received to do the program. There's no prep involved in it. They can eat whatever they want, and they don't have to have a doctor's referral to get the fit kit. Now, the doctors in our region, though, know about the program. And we do have doctors that will often say, okay, you've decided you don't want to get a colonoscopy right now, or you want to try something different. A lot of times a doctor will have you go ahead and reach out to Southern 7 and get that kit. We have several doctors that do that, so that's good. You can also get the kit. Maddie mentioned and Pasang mentioned you can get it through us. We can mail it to you, and all the postage is covered. You can also pick it up at one of our 7 public health clinics. And again, we have one in each of the lower 7 counties in Illinois. And we also have them on our Wellness on Wheels van, which circulates throughout our region every Wednesday. So our staff has them on there as well. And if for some reason we're out that day and we don't have any in stock, just give them your name and your address and your phone number, and we'll go ahead and make sure that you get that. So a lot of ways to get that there as well. Now, if you want to request one on our website, you can do that. Just go to southern7.org and go to our fit page, and it'll have a way there for you to request that. So a lot of ways to get the kit, and very easy to do, and so on. Now, like I mentioned with HBV, we don't test for HBV here. So Mary Grace, what should somebody do in order to get that test done?
Yeah, that's the really great thing. If you have insurance, if you have a primary care provider, during your annual visit, they'll always do a blood draw. And you just have to ask for a hepatitis B blood draw, and they just add it to the vials that they're already collecting. So it's really, really simple, easy, and quick. And for, I would say almost all insurances, it will be free.
Okay, very good. And that's one thing that we're seeing in healthcare is our insurance companies are really starting to look at this on the front end and not the back end. If we can do a lot of these preventative measures before cancer becomes a real issue, that's a win for everyone. So it's good that insurance companies do cover these things. They are promoting fit programs and things of that nature. We do see that in our regions more and more. So that's exciting for our patients. Now let's talk a little bit about the positivity rate on some of this. And, I look at, first off, the FIT program. Nationwide, we have about a 7 to 12% positivity rate with the FIT. Here at Southern 7, we run about 14 to 16% positive. But I want people to realize that, again, like anything else, when it comes to cancer treatment, if you start doing these things early, you're going to prevent problems down the road. So if you're, 45 to 50, even into your 60s, and you're starting this and your test comes back positive, what we find at Southern 7 is the majority of those patients, all they've got is just a polyp that needs to be removed, or, maybe it's a hemorrhoid that's gone awry, whatever the case may be. But in the screening that we have done, and we have done this screening now going on 5 years, I think this will be our 5th year.
Yeah.
We have yet to have a patient that has had late stage cancer diagnosis. But like I say, we've had several, just, more than half of those that come back positive have had to have polyps removed. So when you look at it from that standpoint, the test is making a difference in detecting that early stage cancer for those patients who are hesitant about a colonoscopy, because it encourages them to go ahead and get that colonoscopy and get that done. And you get those polyps out, you're done. You're all set. So we are excited about that. I mean, it's, you start to look at, okay, well, yeah, you didn't have anybody with cancer, but if somebody hadn't have done the kit, would they have had cancer later on? And most likely, yes, at some point. So it is making a difference there. And Mary Grace, we can say that about HBV as well. When it comes to getting that vaccination, getting those testings, getting all that done, again, you're preventing problems down the road. So we're always encouraging our residents to talk with their kids, talk with their grandkids, talk about the cancer history in your family. If Grandpa Bob had a history of colon cancer, this is a test you need to be looking at. You need to be talking with your doctor. And again, doctors are very proactive when it comes to these things. We've started doing genetic cancer testing here at the health department, which is a whole other podcast. But cancer prevention is really a thing right now. And it's important that we talk with our kids about it and with each other to make sure that we're getting that done. I think we've kind of covered all of our bases. Is there anything else that we need to touch on with either one of these programs?
I don't think so. I think you covered everything. Like you said, it's the strongest thing is word of mouth, the support that, residents across Southern 7 will give each other and the encouragement in that and where to find education. So yeah, no, I think we touched on everything.
Good. Very good. Basong, do you have anything else to add for FIT?
No, I think that's pretty much everything. We know it's scary to be screened or just that possibility, but really the first step is this FIT kit is so simple, and we're there for you, like we've mentioned consistently every step of the way. So please go get screened.
Yeah, exactly. And the FIT program with us is not new. We've been doing this for a while. And so we encourage you that if you have a question, ask it. There are no silly questions when it comes to either one of these programs. Please feel free to do so. Mary Grace, do you have anything else to add on HBV?
No, just, hepatitis B is preventable. So test yourself, know your status. And if you need to be vaccinated, the vaccine's safe. And it's a really great way to prevent hepatitis B.
Okay, great. Well, ladies, thank you so much. Thank you as always for the partnership that we have with you guys with Southern 7. It has made a real difference and a large impact in our region. So I'm hoping this is something we can continue for many, many more years. And hopefully we won't have to have podcasts anymore to talk about it. It'll be done.
Many years to come.
Many years to come. So hopefully that'll be something that we'll constantly be talking about. And again, we want listeners of this, if you have any questions at all about FIT, colorectal cancer screenings, HBV testing, and vaccination, talk with your healthcare provider, talk with somebody that you trust, make sure you're getting accurate information. And feel free to call us. We'll give you accurate information. And if we don't have an answer for you, we will find one. As you can tell, I have wonderful partners here, and I learn something new all the time. So please make sure that you check that out. But again, for more information about our at-home colon cancer screening program, which is called FIT, or to get HBV tested and vaccinated, you can visit us online at southern7.org. And again, make sure that you talk with your healthcare provider to see what is best for you. All right, we're going to wrap up this episode of the Southern 7 podcast. Thanks again, ladies, for hopping on with me today. I appreciate it. Please, folks, share this with other family members. We encourage you to do that. But from all of us here at Southern 7 Health Department, stay healthy and have a wonderful day.